Stress leads to bad gut, stress leads to bad metabolic health, and also bad brain health. Stress is important for survival.
So what deficiencies can cause brain fog?
Vitamin B12 deficiency, folate deficiency, omega 3 deficiencies, and so when it comes to brain aging, the one most fiercest disease is Alzheimer's disease, which is basically cognitive decline or also dementia.
Close to 90 lakh people in India have Alzheimer's, and it's projected to double in the next few years. So what are the first signs of that happening?
People will lose attention and focus first. Word finding difficulty could be a problem, and if they want to plan something, that becomes slow.
Does caffeine actually play a role in brain function, or does it help us stay sharp?
If somebody is depending on caffeine to be attentive, to be more focused throughout the day, then that is bad.
What is the importance of getting bored in enhancing your brain?
It's important we feel boredom, because out of boredom rises new challenges. We make new neural pathways, we make new neural connections. Most part of the language is processed in left. Most part of being creative is processed in right. But for memory, attention, execution, we require both parts of the brain talking to each other.
Superfoods that help you stay sharp even when you're aging.
Magnesium rich foods, omega 3 rich foods are important. Along with that,
as we age, all of us want to remember our life experiences, make quick decisions, and keep thinking logically. Along with our physical health, we also wish to maintain our mental health as we grow older. But the statistics say a different story. As we speak, close to 90 lakh Indians are suffering from early onset dementia, and by 2036, this number is projected to almost double to around 1.7 crores. But the bright side is, now we know better. We now have the knowledge and evidence to protect and enhance our brain through daily lifestyle changes. We have Dr. Samatha Tulla, a longevity physician, and today we're going to talk about the root causes of brain health decline, some early signs that you should not ignore, some very cool things about our brain and its connection with the rest of the body, and some practical solutions to stay sharp even as you turn 90. So I remember us having a discussion in your room once, and you asked everyone, what does longevity mean to you?
yes.
And most of the people, even I, answered that we want our brain to stay sharp. Obviously, brain health means a lot, right? So what are your thoughts on that?
I do remember. I think I keep asking this question to everyone. What does longevity mean to you? For a very specific reason, right? People always answer, I want to live longer, healthier. Yes, these are important, but these answers are too generic. So I keep asking them to figure out what is their purpose for it. For me at least, I want to be cognitively sharp as long as possible. It could be into 70s or 80s, and still want to build the things I want to build at any day with same mental clarity, right? So we are talking about brain aging more often because we know as we age, we tend to have lesser, we tend to be less productive. Maybe our processing speed will decline, our capacity to remember things will decline, our execution may decline, and we may plan poorly. So these are different reasons why while aging we are afraid that we may have all of these, and henceforth aging scares us, right? So my intention around it is, today we have a lot of science going on in longevity, not just around how we look on inside, but also how we perform on outside. So in that sense, brain aging is also very closely associated with all other organ aging. So when it comes to brain aging, the one most fiercest disease is Alzheimer's disease, which is basically cognitive decline or also dementia. But again, we shouldn't be confused with brain fog from dementia. People often get confused. Oh, I started forgetting things, I'm misplacing things, I'm not able to recollect. I think I got dementia. People use that term very loosely, but we need to differentiate that from the dementia or actual Alzheimer's disease.
So what would you say is the main difference between what people call brain fog and Alzheimer's, and what is common cognitive decline that comes with aging?
People often get confused, right? From brain fog to cognitive decline to dementia. When should we use these terms? So dementia is progressive loss of memory. When it reaches up to a stage where you forget that hampers your day-to-day work, that your routine work is affected because of that memory loss, then that is Alzheimer's. But how does that begin? One fine day, people don't end up forgetting things. Alzheimer's can happen 10 to 15 years before that, even sometimes 20 years. But how does it begin? It begins with slower processes, like your processing speed becomes slower. So, and your executive function, for example, you're planning for something, that planning becomes delayed, and your decision making gets delayed. So this is how it starts. Or you will have difficulty finding words. Like, people often struggle to remember a specific word where they want to talk about, because they're not able to comprehend well because of forgetting certain words. So this is how it can start off with some 10 to 20 years, even before people actually start forgetting major things that can hamper their day-to-day life. When it comes to brain fog, it is mostly because of poor sleep, nutrition deficiencies, bad gut, bad hydration. So that could be something like misplacing things, not recollecting people names. That happens on a very short term. But if that is happening over a long period of time, then that is a concern. This is how I would differentiate it.
You mentioned that Alzheimer's can happen 10 to 15 years before the symptoms even show up.
Okay.
Right. So, what are the first signs of that happening, and can we prevent them?
Yeah. The first signs of Alzheimer's are usually called mild cognitive decline in very medical terms. But what would happen in that is people will lose attention and focus first. And also they'll start losing their working memory or execution function. These terms also mean they would lose focus, they would forget recollecting the very commonly used words. So word finding difficulty could be a problem. And if they want to plan something, that becomes slower. So they would struggle planning, they would struggle with decision making. So these are the initial few symptoms that could come up.
And you mentioned that brain fog is often caused due to nutritional deficiencies and dehydration. So, what deficiencies can cause brain fog?
The most common ones that I often see many people having them are vitamin B12 deficiency, folate deficiency, omega 3 deficiencies. These are the most common ones, and magnesium deficiency too. So, these are the very common nutritional deficiencies.
And nowadays, since work and life is so fast paced, a lot of people face a lot of stress, and based on that, I'm sure you've also heard a lot of people complain that, I'm very stressed, I'm not able to remember things properly. So is stress also causing cognitive decline in people?
That's a very important question, because today we say stress leads to everything. Stress leads to bad gut, stress leads to bad metabolic health, and also bad brain health, right? Why does it happen? Stress is important for survival. But acute stresses are important. You should have stress sometimes in your life. But as you said, fast-paced world, we are stressful all the time. So any stress would drive cortisol release in the body, which is driven by hypothalamo-pituitary axis. Cortisol rises, and cortisol also blunts back to baseline. It should happen. It should spike when needed, and it should come back to baseline. But because of micro doses of stress, it could be like, okay, I'm doing a podcast here. Did I forget something at home? Did I not carry my box? Are my kids waiting for something? Did I call my driver? Am I receiving any email notifications? How is my calendar looking like today? If you keep thinking about so many times and not being present at the moment and not focusing on the current thing, that is microdoses of stress. When these microdoses of stress happens, body will assume this person is in danger, let me release some more cortisol. So those cortisol spikes happen throughout the day, sometimes many times a week or a month, and even before it reaches baseline, we are again spiking it. So this chronic sustained elevation of cortisol can hamper and bring changes in the brain. For example, what kind of changes can it bring? It can bring something called neuroinflammation. It can hamper detox mechanisms in the brain. We all sleep, we all detox. There's something called glymphatic system in the brain. That clearance can be hampered. So what happens? We end up clogging all the unnecessary and misfolded proteins, also called beta amyloid or tau proteins in the brain, and they get clogged, and that will accelerate or increase your risk for Alzheimer's. So this and also this chronic stress will affect something called memory center in hippocampus, and can also shrink our brains and cause neurodegeneration. Also, do you know all of us have a capacity to make new neurons? So that capacity, that neurogenesis will come down. So overall, this chronic sustained stress which can cause sustained elevation of cortisol will shrink our brains, will affect our brain detox pathways. It will impact our memory center in hippocampus, and all these things happen in the brain.
So, as we were talking, the concept of sleep came up, right? We sleep to detox. So, if we were to have hampered sleep, or if we were to not sleep at a stretch, would that impact our long term brain function?
Have you noticed somebody who is a different person yesterday, didn't sleep well last night, comes back today as an entirely different person, is more agitated, more fragile, or more anxious? We see that, right?
Yes.
They have different personalities depending on how. Then we would be like, did you sleep well last night? Like, did you eat good food? Did you hydrate well? So these are the common questions we come up with. Yes, sleep does bring good brain health changes. Now we keep tracking a lot of things, right? Nowadays we are tracking brain age, depending on how well we are sleeping. But people assume, lot of people assume, but doctor, I sleep well every night. They say so. But they do not know what is the outcome of the sleep, how well they have spent in their deep sleep, which we need at least 50% of our entire sleep duration should be spent in restorative or deep sleep. If that is happening, that means we are having good release of insulin like growth factor, which is very, very important for our repair and recovery. All the best benefits of exercise that we did in the morning would come up in the night. And brain will be actively clearing this amyloid plaques that I'm talking about, which can lead to accumulation of lot of them could lead to Alzheimer's. So brain will be actively clearing these amyloid plaques, tau proteins, and will reduce inflammation. So all these good things happen in the deep sleep. So that is why lymphatic system is doing its job. Even while we think our brain is resting, it's doing its clearance job. So it is very important to clear our head in the night, literally, to be more active and more present and more healthy brain throughout our life. So yes, sleep is on the top for brain health.
What about what we eat? Like, our nutrition, what we eat throughout the day, does that impact our sleep in the night?
Very much, very much. If you are wearing a wearable, if you're tracking your sleep data, you would see that when you're eating lighter meals, when you're eating meals at least 3 to 4 hours before your bedtime, you'll see you'll have a good restorative sleep that night, and you spend good amount of time in deep sleep. But in a contrary to that, try eating heavier meals, carb-rich meals, very spicy meals, high on meat. Eat closer to bedtime. You would definitely see that you're not spending good amount of time in deep restorative sleep, because your body is busy doing something else. Your digestive system is busy all the time, and there's no point your heart rate or core body temperature will come down. Only when core body temperature comes down earlier in the sleep, all the positive benefits keep happening for your brain. So it's important we bring down this core body temperature. But if we are eating something like a heavier meal, or even high intensity exercise, or even workouts very closer to bedtime, will keep your body awake and your core body temperature is high. So, and you're very stressful towards your bedtime, and you're still working on certain projects which keeps you awake and you're not able to relax, all these things will affect your sleep. Heavier meals, high intensity workouts, stressful events before your bedtime. So body should know that you're winding down, only then you're going into deeper sleep.
And what would you classify as what people call brain food? Superfoods that help you stay sharp even when you're aging.
Very importantly, even before we go to functional foods or brain foods, we should know what we shouldn't do with the brain. Okay, coming to nutrition again, alcohol can shrink your brain. Alcohol can affect your memory center. Alcohol can impair a clearance of amyloid proteins. Alcohol can reduce neurogenesis. So it can do all those ugly things. So alcohol is bad. Second most important thing is any inflammatory food. It could be deep fried foods, ultra processed foods. All these foods which are inflammatory to your brain as well. So it can trigger neuroinflammation. So we should be away from ultra processed foods, sugars, stress, and I mean, staying away from stress, I mean how we perceive stress, right? And alcohol. If you're eliminating all of these and then concentrating on brain foods, does bring a lot of change. So now coming to brain foods again, what are these very important foods? On the top are magnesium rich foods, very very important for us to calm down, because magnesium is very important mineral which is acting at something called glutamate receptors, which are important for us to calm down. So magnesium is rich foods are important. Omega 3 rich foods are important, like walnuts, fish. These are very important. And also omega 3s are important because it is very important core molecule to make neural connections. Along with that, vitamin B12 and folate are very important. That will make sure we are methylating well and we are very alert, our focus and our attention improves. Berries are fantastic polyphenols that are important for the brain too. So on the top would be omega 3 rich foods, berries, magnesium rich foods, vitamin B12 and folate rich foods, eliminating all the inflammatory foods. And dark chocolate too, because dark chocolates have also got good flavonoids and flavonols, which are important for brain health.
It's a common saying that diet and exercise together are important for good health, right? So based on that, I was seeing a video of Dr. Mark Hyman where he talked about how sitting ideally and doing physical activity regularly had an impact on brain activity. So what is the relation between physical activity and having a sharper mind?
As you rightly said, movement makes us more active. Movement improves our brain health. Movement improves our functionality, right? So there's something called functional MRI. I think this is the study that you're referring to. People, they have done functional MRIs on individuals who are being sedentary and also functional MRIs on individuals who are more active, or maybe people who have done recent physical activity for about 20 minutes and their functional MRI showed most of the areas of the brain are lit up. It only shows that any kind of physical activity would actually improve or release something called brain derived neurotropic factor. It is more like a fertilizer to your brain and will keep areas of your brain more active. That's the reason why people who have any kind of mental health issues, like who are going through depressive episodes or anxiety episodes, first prescription for them would be exercise. Any kind of exercise will improve all the areas of the brain, and BDNF is improved and they feel more alert, and brain feels more active.
So coming back to Alzheimer's, even I see myself, forgetting something sometimes, or words just slip out. I don't remember certain words. So for people like me, people like us, should we be scared?
I don't think we should be scared. We should be more informed and more alert for sure. If you have done your genomic screening, if you think you have a ApoE4 variant, then you should be more cautious when compared to others. So you should be cautious and alert than being scared for sure. So what we can all focus on, and a lot of studies, not just studies, right? My own experiences with a lot of clients do show that right kind of changes in the nutrition and in the lifestyle, having purpose, doing things which are more creative, more purposeful for us, and picking up challenges. Basically, the brain should be challenged. So doing all these things do drive something called neuroplasticity, where it is a trigger for your brain to produce new neural connections. It will be like alarm to your brain, like she's doing something new, she needs new pathways. I think she picked up new instrument. I think she's making new social connections. She has some purpose. Let me make new neural connections. That is what your brain does for you. So again, that depends on how well you're nourishing it, how much of stress that you're giving the brain. So when you're doing all things right in terms of nutrition, you're moving, you're improving your physical activity, you're challenging your brain, you're being more purposeful, and you're sleeping well and you're hydrating well, then I think there are very, very high chances, though you are genetically at risk for Alzheimer's, there's definitely, these are all the things that we can go about and start doing, and definitely we can delay this mild cognitive decline even before the real Alzheimer's kicks in.
Have you ever had a patient or have you seen someone reverse their Alzheimer's?
Okay, let me put it this way. If it is an end stage Alzheimer's where it has come up to a stage where their day-to-day functionality is affected, like they're not able to do anything because they forgot what is the purpose of glass. Are we meant to pour water, or what is it? What is the purpose? If day-to-day life is affected because of that dementia, when the stage has reached up to that, then chances of reversal are very less. But even before that, where the things have started at a mild cognitive decline in terms of attention, in terms of minor things in terms of memory or processing speed or execution speed, there are definitely a lot of things that we can do today.
I recently read a statistic that close to 90 lakh people in India have Alzheimer's, and it's projected to double in the next few years. Right. So do you think the next generation, the younger generation, are they going to be smarter, or their memory is going to decline it's going to decline very quickly as they age?
Younger generation is way more smarter, way more informed. They have way more dopamine rush all the time. That is a problem too. When the brain is forever in the loop of this dopamine rushes all the time, then the prefrontal cortex, which is very important part of the brain, which is involved with attention, memory, and execution, falls back, or it is not used. So always the brain is busy dealing with very superficial surface things, and the problems that a younger generation could have is they will be more cognitively fatigued, that is for sure. If they don't do these offline workshops, or they don't frequently go offline, or if they don't focus on sports, not doing a lot of physical activity, that is going to affect them. So it's very important for them to go offline, do more physical activity, spend more time outdoors. Then they will be cognitively very fatigued, and it could affect their working memory, long-term memory. It could affect their neuroplasticity. It could affect their executive function for sure.
Since you talked about the younger generation staying online all the time, I've been hearing a lot this one term called digital dementia. Could you expand on what that is?
It is a very functional term. There's no gold standard diagnosis that we do a scan or a blood test, then I understand it's digital dementia. No, it's something very functional. Like, as I said, if you're spending a lot of time on blue light constantly, and you're not challenging your prefrontal cortex in more memory formation, in being more attentive, being more focused, that is when they start losing focus, they start losing their working memory, they start losing their executive function. So, and also, that could end up with dementia and forgetting things and memory loss. More than that, it could affect in other way as well. Suppose if you're doing more of this digital stuff, you're exposing yourself to a lot of blue light closer to your bedtime, then that could impact your melatonin, your sleep architecture, your deep sleep. Then the brain is not detoxing well. Then you could end up clogging your brain with a lot of these misfolded proteins called amyloid plaques and tau proteins. Then ultimately you could end up with Alzheimer's. So it's just that lot of digital stuff or being more digitally inclined can increase the chances of developing Alzheimer's disease. And that could speed up the process.
Okay, what is the difference between dementia and Alzheimer's? Because nowadays I see a lot of people use these terms very loosely. Like, I'm forgetting some things. I might have dementia. I might have Alzheimer's. So I know that they're two different things, but what is the difference between them?
To diagnose Alzheimer's, one should have something called beta amyloid plaques, and also they should have something called misfolded proteins at tau. So there's a diagnostic test, there's a blood test, and there is a functional MRI to diagnose it. If these beta amyloid plaques or tau proteins are not there in the blood or in the brain, there are high chances your dementia is because of some other reason. Now we call Alzheimer's as type 3 diabetes today. Why are we saying that? Because Alzheimer's also, along with having these amyloid plaques, do have neuroinflammatory cytokines. They have high oxidative stress. The brain withholds a lot of oxidative stress. More neurodegeneration is happening. So these are the few things that are happening in Alzheimer's along with amyloid plaques. It's neurodegeneration, reduced neurogenesis, more oxidative stress, more inflammation in the brain. So these are the other things that are happening because these are also very common to type 2 diabetes. That's why Alzheimer's is called type 3 diabetes. And even having insulin resistance, which is systemic insulin resistance, can accelerate somebody's risk of developing Alzheimer's disease.
If someone's watching this video and their parents are starting to forget things or starting to show early signs of Alzheimer's, in your opinion, what should they start doing right now, today?
I think all of our parents, grandparents, they should always screen for these few blood biomarkers for sure. One is home IR, fasting insulin, fasting blood glucose. So that is to identify our risk for insulin resistance. And number 2, nutrient status. Check for magnesium, zinc, vitamins B6, B9, B12, and check omega-3 to 6 ratios. Apart from that, we should also be screening for, looking into their sleep architecture. Sometimes people having sleep apnea issues, obstructive sleep apnea issues can also have mild dementia, can also have brain fog. So it is important they get a polysomnography. Sometimes sleep apnea is mistaken for having Alzheimer's. So these are the few things, along with digital brain function analysis to actually identify are they having mild cognitive decline, which are the very early signs for developing Alzheimer's. So these are the few things we should all be doing for our parents.
A lot of people start their day with coffee and drink coffee throughout the day. And they say it helps them stay awake. Does caffeine actually play a role in brain function, or does it help us stay sharp?
I think when you're talking about coffee, you mean plain black coffee, not with milk and sugar, I hope, because sugar is very inflammatory to the brain, and if anything it's coming with sugar, it's bad. Okay. Talking about caffeine alone, if it's a good form of caffeine, it's good for improving our attention and focus in a short term. And during dedicated time window, it's relevant, it's important too. And there are a lot of new studies which are showing it improves because it has polyphenols which are good for brain health. So having it in moderation during specific time of the day is important. But it's important also not to start off the day with caffeine because we want adenosine levels to come down in the body. Basically, we want our body to naturally wake up and have that good cortisol spike, which is not affected by caffeine. And then we can have caffeine after 1 hour after waking up. But if somebody is depending on caffeine to be attentive, to be more focused throughout the day, then that is bad. Also, if you are a person, you got your genetic test and you have a gene mutation for CYP1A2, then you are very caffeine sensitive. Your body holds caffeine for a long time in the body and it's not metabolized soon. So you'll have long-term effects of caffeine compared to others. Then in that sense, they should limit to lesser drinks and also to a shorter time window.
Does a person's body fat or their blood pressure also affect their brain function?
This is a very important question because I often get to hear brain health is very independent of our internal health or metabolic health, right? Now everything is very interrelated. It could be our gut, it could be our visceral fat, it could be our insulin resistance and brain health. All of them are related. And then in that sense, we should also be focusing on keeping our insulin very sensitive. That means having less visceral adipose tissue. By less, I mean optimal visceral adipose tissue. It's important we are insulin sensitive. It's important our HOMA-IR is maintained less than 1. It's important we maintain good levels of vitamin B12 and folate and magnesium, zinc and omega-3. And it's important we maintain ideal blood pressure. If not, what happens? When we have insulin resistance, we have it in the brain too, and it will increase something called oxidative stress in the brain, and it would affect our memory center in the hippocampus. What happens if we have higher blood pressure? It can damage microvasculature, which are tiny little blood vessels in the brain. If that is damaged, it can cause inflammation and it can cause other effects. Insulin resistance is very crucial and central component of developing Alzheimer's. So it's important we reduce neuroinflammation, it's important we reduce insulin resistance. We can work on all of these. When you said, is there a way for us to reduce our risk for Alzheimer's disease? Yes. If you have early onset of insulin resistance, reverse it. If you have early onset of hypertension, focus on reversing it. If you're too much dependent on sugars, too much dependent on ultra refined foods or trans fats, reduce them. If you're deprived of sleep, improve it. If you're not challenging your brain enough, challenge it. If you're not feeling boredom ever in the last few years, please get bored. So do all these things. Go offline.
What is the importance of getting bored in enhancing your brain?
Yeah, I told you. You asked me initially, remember, do we use left side of the brain or do we use right side of the brain? Do we independently use them? If you're focusing on language, then does right brain go off? Or if you're being more creative, does left brain go off? It doesn't work like that. Yes, most part of the language is processed in left. Most part of being creative is processed in right. But for memory, attention, execution, we require both parts of the brain talking to each other, right? And it's important we feel boredom, because out of boredom rises new challenges. We make new neural pathways, we make new neural connections. Our synaptic system, which is nothing but mix of neurons or neural pathways, are created more. If we are creating more of those neural pathways, our neuroplasticity improves. If you're being more neuroplastic, then your risk of Alzheimer's reduces. So that's the reason feeling boredom will keep your brain challenged. I hope you enjoyed today's video. We are trying to simplify the complex longevity topics for you. For more such videos, please subscribe to PMX Health.